Welcome to Inner Compass. I'm Shirley Hoogstra. When we think of the need for an improved healthcare system, often the focus is on the patient's experience. But our guest today says that we have to back up a step because there can be no strength of care if the caregivers themselves are discouraged to the point of exhaustion. We'll look at what makes a healthy work culture today on Inner Compass.
From the campus of Calvin College, this is Inner Compass, exploring how people use faith and ethics to guide them through critical issues of today.
My guest today is Bonnie Wesorick, founder of the Elsevier Clinical Practice Model Resource Center in Grand Rapids, Michigan. This center has developed tools used across the country to improve elements of the care process, from decision support to healthy work cultures. Welcome, Bonnie.
Oh, thank you for inviting me.
You had a situation where a student of yours sort of called you out on the duality between what she was taught in class and then her actual experience on the floor of a hospital. How did that hit you?
Well, you know what? It was at a time that I really needed to hear it. And I was becoming aware of the fact that we had great discrepancy between what we were teaching and what was being lived in the real world. And she just was able to articulate it so clearly to me. And
she was angry and frustrated.
Oh, at a real high level. She was the best student I had ever taught. She had the two characteristics of a healer. She was brilliant and compassion seeped from her bones. And I just felt that she would someday work in the area I loved, which was intensive care. And so she was in the intensive care unit, and that's where I was her instructor. And one day, the manager said, "We need to talk." Now, I knew this wasn't good. It would be about a student, but certainly not her, the best I'd ever had. And she said, "You have a student who'll never make it in the real world." And I said, "Well, what are you talking about?" And she said, "She's so disorganized. She's the last one off the unit every night. She'll never make it in the real world." And I said, "Who are you talking about?" And it was her.
Wow.
Which led us to have the conversation where she said to me, "I'll never work in intensive care. This is not a good place." And I said, "Tell me what you mean by that." And she went on to give me clinical scenario after clinical scenario that she had observed that anybody who would have been listening, who knows healthcare, would have said, "Oh, of course, I've seen that happen and happen." And I actually thought, I hope it wasn't me that she saw doing that.
Right.
And that's how real it was.
So what she was experiencing in terms of sort of a pace of practice and the stress of the practice and did not conform to the kind of compassionate person she wanted to be to that patient.
Yes. What she was noticing is that the only thing that mattered was how much you could get done, how fast you could do it, not what really was going on with the patient. And that she would actually say, the reason why she was late getting off the unit, she learned something very early, and that is that if it's important enough to get done, you better do it. And I didn't have the wisdom to be able to say to her, "You're never done in healthcare. There's no such thing. All there is turning the accountability over from one colleague to the other." What she said is, "You live a lie."
You live a lie.
And I said, "Tell me what you mean by that." She said, "You taught me the beauty of practice and sent me to a world where no one can live like that. What are you going to do about it?"
Wow.
And it's because of her that I literally quit my job, went back to school and said, what is there about our culture that we need to change so that there isn't this gap between what we're teaching and what they're living? And that was the beginning of this work.
Oh, so you have a belief, and now you've given a substantial part of your life to bringing together this idea of healthy care providers makes healthy patients.
Yeah, you know what? We have to, the healer cannot be frustrated and tense and running around like a fool half the time. They really need a culture that has been designed to support them in the work to be a healer. And believe it or not, it is not the norm.
No, so your resource center comes alongside and partners with hospitals. How do you get in the door?
Oftentimes we get in the door for not the reason we are there. What happened is I realized that we needed healthy cultures and we needed tools and resources.
And you're talking about on the floor. So if I'm a patient, I'm going to experience a floor that not only gets me the right medicine and that takes my blood pressure, but there's something else that's happening on that floor.
This is where you're going to get your care.
Right.
And so when you come to receive your care, you're going to be cared for by a whole team of people, all with different expertise, all really, really want to be there. They really do. They want to be there and they're committed to give the care. Well, what happened over time, what I noticed is that we didn't have the tools that we needed to do the work that we had to do. We didn't have tools that would bring us together, technological tools, the electronic health record. We couldn't make it without it. We really can't. We need resources right at our fingertips to help us to know the patient's story, to know what's important to them, to know the latest evidence of how to take care of them. There's 1 million articles a year created on the latest evidence.
So how would you get that to the person who's at the bedside? What was your vision for that?
Well, it was sort of exciting because it had never been done before. And so I realized that we didn't have time to stop and go check an article out. So what we could do is if we knew what the latest evidence was, we could put it and embed it into the electronic health record. And it can be there when you need it. And so that's what we did.
So you were piggybacking on this an innovation,
yes.
right? So this electronic medical record, which everybody now carries around, sort of looks like an iPad.
Yeah.
Well, you're saying the best for the patient would be to have that medical research right there?
Right there. Not only that, it would be a framework for any clinician, no matter what role or discipline they're in. We did a framework design that said, when you're with the person, you need to know their story. Know them in their wholeness, physical, psychological, social, cultural, and spiritual dimension. Now, wouldn't you think that that would be the norm in healthcare? Well, it's not, because generally the documentation tools that were designed were all based on checklists and getting tasks done and getting the orders carried out. And often we didn't know how collectively together to know the patient in their wholeness, to individualize their care. At times, we didn't even know the latest medical evidence. So by embedding the evidence where you need it, so you have it at your fingertips, then you can spend your time to say, tell me, what do I need to know about you? What is really important to you? And what is the best way for us to partner with you to help you reach your ultimate health?
But how does that then rub up against the experience of healthcare providers where they feel rushed, or they don't have time to stay at the bedside, or the patient talks too long and the bells are ringing for another patient? How do they manage that?
Well, you can imagine that the demands are very, very stressful. I had an interesting aha, and believe it or not, it happened on a plane.
Oh.
And I was sitting next to a young man, and I was working. I'm typically working away. And he said to me, he tapped me on the shoulder like this, and he said, do you have a minute to answer a question? I said, oh, certainly. And he said, is your work about creating healthy work cultures? And I said, well, yes, it is. He said, are you Bonnie? And I said, yes, I am. I have my name on my handouts. He said, I couldn't help but notice you're a nurse. And I said, oh, yes, I am. And then he said, how is it you gave up nursing to do this work? I must have had a terrible look on my face. And I said, oh, I haven't given up nursing. I'm doing some of the highest level nursing in my life. It's just that now I've committed to care for those who give the care. He said, how is it that you got into creating this healthy culture? He was greatly interested, but I didn't know why at the moment. And I said, spontaneously to him, it's a long story. And he said, start from the beginning.
Wow.
And I said, well, it's the hardest work I've ever done. And he said, then what gave you the courage to do it?
Oh, great question. That's a great question.
I said to him, no one's ever asked me that before. And I said, I want to honor your question, and therefore I'd like to reflect on it for a moment. Can you give me some time just to think? And I said to him later, I'm ready, and he's so good. He was really eager, and I didn't know why. And I said, when you asked what gave me the courage, I thought of people. Courage begets courage. And I thought, there are so many, but there were 3 that stood out. And one was my best colleague, just an excellent healthcare provider. And one day she said to me, I want you to be the first to know. And I said, no what? She said, I'm leaving. And I was just sick about this.
She was quitting.
She was quitting. And I said, why? And she said, Bonnie, I need to leave before I lose my soul.
Oh, before I lose my soul.
And
That's deep, isn't it?
And I said, I remember out loud for the first time ever saying, this is a hard place to work. It would be nice if we didn't have to work so long and so hard and not have enough support and education and so many double shifts. However, that wasn't enough, I said to that young man. But it was imprinted on my soul what she said.
Right.
The second one was an unforgettable event. I walked into the unit, and the manager said, have you heard? And I said, no, heard what? She said, last night Tom committed suicide.
Oh, my goodness.
Now, Tom's my closest colleague.
Oh, my goodness.
He's the kind of person you'd want to take care of you.
Right.
He was brilliant. He was passionate. He was compassionate. He would walk in the unit every day and say, okay, you need any help with anything? And it didn't matter whose patient it was. That was irrelevant. This was our unit.
Right.
And when she told me he'd committed suicide, you know what my first reaction was? I wondered what role I played in his death.
Wow.
I was his closest colleague.
Right, and
How
you didn't
could
know?
I have missed this?
Right.
What was
Right.
it? And you know what I decided? We never will know why he died, but I learned one thing, and I bring it to every place I go today, every place. What he taught me was if we're going to be healers for this humanity, we first must care for one another.
Right.
And you know what? I said out loud that day, you know, this isn't a good place. You know what we do here? We work each other to death, and we very seldom stop to say thank you. Do you know how important your work is? And I was sure that I hadn't thanked him enough. And I didn't want to accept at that moment that I might have been the only one. That was the second event. But the third was a student that you had just brought up. And I decided that we had to create cultures worthy of the commitment of the people who come through the doors of healthcare every day. They come longing for this. This is why they became healers. And I said, so that's why I do the work I'm doing. And he says to me, there's something you need to know. He said, I'm 39. I'm an extremely successful businessman. I'm a multi-millionaire. I'm one of 6 executives for a worldwide Fortune 500 company. And I was the 5th man in our 6-man team to have a heart attack.
Wow.
I had mine at age 38. I know the stress of the cultures. This is why I had a heart attack. Keep up this important work.
So he was thinking about healthy work cultures even from his environment.
His environment.
This translates not only from hospitals and healthcare settings, but into a lot of places.
It's absolutely transferable.
Right. And
Absolutely.
part of that, you talk about the values then that
Yes.
your resource center has identified. And a lot of it is about team building and communication, dialogue. You talk about all those things. Is it possible? You know, when you go into these big systems, you think, that's the courage question.
Yes.
Come on. You're going to change this whole multi-layer, multi-people, profit, needing organization to be a little bit more team-oriented, a little bit more caring about the individual. Is that really possible? Bonnie,
Yeah.
have you found it to be possible?
It is so possible. It's why I feel so privileged to be doing this work. And I just recently, just last week, I was with 500 clinicians, and one of them came up and said, do you think this can happen here? And I
Right.
said, only if you want it to.
Okay, so now how do you take it? Because we've all experienced work cultures, and certainly we all have friends and relatives who are in the healthcare profession, and they say, we're stressed, we're short-staffed, we will work long hours, we've got too many demands, the patients are really sick, and what the hospital wants is efficiency, efficiency, efficiency.
Yes.
Don't stand by that bed and talk. This is about profit, not touchy-feely. Okay, so that's it.
You are really good. You have just described the common scenario brought to me.
Right.
By what? Intelligent, committed, caring people.
Right.
Isn't that interesting? So for me to understand this, I had to say, what in the world is culture? Now,
Okay.
what does everybody tell you? It's invisible, but you can feel it, and we all know that.
Right.
And so I'll share with you my definition. Not
Okay,
for you to,
because I think it's very helpful to
not
know
for you
culture.
to accept.
Okay.
But just to think about. Because I think culture, it's invisible but tangible. So what are you feeling? I think you're feeling the presence of the unseen souls of the many who are walking there. Now, some people don't like the word soul. I don't care what they call it, heart, spirit.
Right.
But that is that place where our humanness sits, our greatest authenticity sits. This is where we connect as humans. And we start to look at healthy cultures and unhealthy cultures, and what's the difference between them? Because our whole team, we're out in this world at different places all the time. And I have been with hundreds of organizations. And you can almost tell when you walk in, the healthy and the unhealthy. So,
what is it?
Guess what? It has nothing to do with how busy they are.
Oh.
It isn't that. In a healthy culture, the many people who are there are connected at the soul level. They know what matters most, and they connect around it. So if you're in an organization where the reason we exist is not at the core of an expectation and a conversation, something's wrong. We must have shared purpose. You know, Goethe, the German philosopher, said, things which matter most must never be at the mercy of things which matter least. And believe it or not, we had lost sight of that in all the busyness of our task. So what we do?
Yeah, how do you transform that though? Because you still have all the call lights going on and you still have those sick people. So how did you help people connect their souls?
Well, we did it because you have to create an infrastructure within the organization to bring those teams together, to honor each other, to hold each other in deep respect, to know what you do, you know what I do, and we build on each other's expertise. And if there is not a partnership infrastructure within the culture, it just won't work. We know how to establish those. We've done it in thousands of places.
Okay.
And it is amazing to bring a team together around why they came in the first place. But then you got to give them the tools to be effective and efficient.
Right.
Because in the end, they got to walk out there in that busy world. So we created tools that really work. And we provided a framework for them to collectively learn the patient's story. Whether you're the physician, the nurse, the PT, the OT, the chaplain, we stopped all the duplication and repetition of asking the people the same questions over and over and
We've
over
all experienced
again.
that.
Yes.
Right.
And with technology, you can do it at a very high level. So we created technology that actually helped them to remain human, to ask them to ask the question only once. And when you ask it, I build on it. I don't repeat it again. And so then we have to teach them that, because you know what? It's really new.
Okay, but this talks about leadership. You're talking about people who are
Yes.
dedicated to this and are willing to lead the teams on the floor. Would that be the nurse manager? Would that be who on the floor says our culture here is going to be about listening and respect and getting the patient needs met? Who is the cheerleader for that so that these cultures change?
The staff.
Okay.
It is not the manager.
Oh.
That's where our weaknesses came. I don't mean, you see, we have gotten into the old way of thinking. And the old way of thinking, and no better place to show it is in healthcare, we were embedded in a culture that was started in military and churches and academia. Very hierarchical cultures, right?
Right.
And what we didn't know at the time, and I didn't know, and had to learn, is that there is a skill that we were missing called polarity management. It is the ability to handle dilemmas and paradoxes, which are all over. Because you see, in the vertical, that hierarchical relationships, there's another pole, and it's equally as important, and it's called horizontal partnership pole. And you have to have both.
Horizontal partnerships and the hierarchical model can actually coexist, as you're saying.
They're polarities. I loved a statement by Scott Fitzgerald. He said, the first test of intelligence is the ability to hold two opposing views and take action, right?
Yeah.
That's polarity management. It's two different views, both important, and together you reach a goal neither can reach alone. So we knew we had to have hierarchy, but we had to have our teams, and the leaders of our team became the staff, and they needed the skills to do this. They didn't have that. It's not a matter of boss subordinate. It's a matter of you have a skill I don't have. Managers have skills that staff don't have. The PT and OT and physician nurse all have different skills. Interdisciplinary is our only hope because there is no one person, no one discipline, no one department that will ever determine quality care for the people we serve. It's all of us. And we have to really come together and learn. What's amazing is that this week our staff is out teaching scope of practice, which means they're sitting in a room with every discipline that cares for a patient and said, tell me what you do. Let me tell you what I do. This is what I need from you. What do you need from me? And you will be amazed to know that right now, there are people in this room, I would bet big money on it. There are people in the room saying, I didn't know you did that.
Right, because they haven't listened. They haven't taken the time to know each other's stories.
That's right.
And there's a humility and a respect. Humility, I can learn from you.
Yes.
And respect, maybe you can teach me something. And the time it takes to listen. So is what you're saying, if the staff is committed to actually exercising that kind of relationship with each other, the burnout will stop and the quality of care will go up.
Yeah, you know, the burnout is the seepage of the passion from their souls. That's
Right.
what it is.
Okay.
And so if they're not in a culture where that is honored at all times, it just eats away, you know.
And people quit.
Oh, they quit.
Right.
Oh, absolutely. So what we learned is they also don't have the skills, believe it or not, of having dialogue, meaningful conversation. They get task dominated, they get very fast, we get social conversation. We literally had to go back and say, let's talk about having hard, meaningful conversations with one another first so that you can have them with patients and honor. And dialogue's based on this principle that believes this. And I ask people, do you actually believe that the people that you care for and the people you work with know things you don't know? Do you believe they have a wisdom you don't have? Well, they'll all say yes. Well, how do you tap it? No one person can do it. So I have to build on your expertise and you build on mine. And we learn to do that. I don't have to repeat everything you've just asked. I don't have to repeat what you have just done. But if I don't trust you, I will repeat. So we literally have to have an understanding of what each other does. And then the tools. Now, I have to tell you, you want to get efficient and effective. You intentionally design technology to serve the clinicians so they can better serve the patient. How it serves the clinician is it brings them together collectively. They're all putting their work in the same place for the first time, not in charts here and charts there. It's all in the same place. I can pull it up in a heartbeat. I can give them the information they might not know, that this patient is at risk for 16 common complications, and if they don't know them, push a button, it'll tell them. And it serves them so they can better serve the patient.
And so is that what your resource center does?
Yes.
Okay, so you actually can go in and give them some new ideas, some new tools. And when you talk about the tools, you're talking, one, about using technology to foster this care for the clinician.
And in the technologies that we give them, the patient's story, that they will ask the patient, the questions they will ask, and then they will put into there, and so it doesn't have to be asked again, are in wholeness of body, mind, and spirit. And they have been researched and looked into, and we have learned how to capture a patient's story so we can pass it on to the next person.
Okay, so now if I'm a clinician, and I'm sensing, we all can sense it when you're feeling tired and stressed.
Yes.
How do healthcare providers evaluate their own health?
Well, it's probably one of the weaknesses within healthcare. They come because they want to serve. And unless the organization that they're in, seriously, is committed to help them to be healthy as well, it falls down by the side. So you really have to be working in a place where they hold each other in the deepest of respect. And those are words we all always used. And I have to tell you, it's harder than you think when you're running around being busy to have somebody come and interrupt you and then hold them into respect. Where I learned the most from that was from one of the best clinicians I ever met. And she worked with the drug addicts on the streets of Detroit. And I went to her one day and said, you need to teach me about respect, because when I get busy, it's so easy to let it go, right? And so one day I was on the streets of Detroit. Here is a very sick, addicted man. She's on one side and I'm on the other. And I noticed, as sick as that man was, he found me annoying. And what he was doing was moving away from me, and I wondered why. And I looked over at her on the other side, and this respect she had for him was palpable. And I stood up and walked away and only watched. And here's what I learned. She saw him for what he could be, not what he was. You know why he moved away from me? I never said one word. But I was disgusted by the maggots in his sandwich, the smell, his words, how he was dressed. I saw him only as he could be. Only as he was.
Right, only as he was.
She saw him as he could be. And it And you have to really work on holding each other in respect when you're tired, running around like a fool, and frustrated. And so what you do is you help each other to remain human, help each other not to be exhausted, to take better care of ourselves. We actually, in one place, started a program where you could have a day off with pay to get yourself healthy. And your team could say to you, you know, you need to take care of your own life here, because when you're here, we need you to be present with us and really help. What can we do to help you? And we actually created funds to make that happen.
Well, you actually empower your healthcare providers to not take care of only the patient, but to take care of themselves.
Absolutely.
That's a paradigm shift, and it's the kind of paradigm shift that will actually make us all healthier.
Yeah, and if you think about it, the majority of adults spend more waking hours at work than they do in their own homes. If this isn't a good place, a place where we honor each other and help each other and respect each other, what are we saying?
I think you have a vision that's very compelling for all of us, Bonnie. Thank you.
Oh, thank you.
My guest today has been Bonnie Wesorick, founder of the Elsevier Clinical Practice Model Resource Center in Grand Rapids, Michigan. I'm Shirley Hoogstra, and thank you for watching Inner Compass.